Welcome everyone to the Harvard THN School of Public Health. My name is Andrea Baccarelli, and I have the great privilege of serving as the Dean of Faculty here at the school. And it is my pleasure to welcome you and our distinguished mayoral guests here on the stage and some in the room, our partners for the Bloomberg Center for Cities, and of course our students, faculty, and friends to what certainly will be a vital conversation today. At our school, we have the firm belief that homelessness is front and center to public health. When someone lacks stable shelter, every health outcome worsens. Chronic disease goes unmanaged, mental illness goes untreated, life expectancy drops dramatically. This is not just common sense. There is research backing all of this. It is unambiguous. Housing is health. And that is precisely why homelessness is so important here at our school and Harvard in general. The initiative on health and homelessness, led by our faculty, our co, has been working to build the evidence base, train the next generation of practitioners, and promote exactly the type of forums we are witnessing today. Our overarching goal is to provide institutional leaders, policymakers, and ultimately our society with both the scientific and technical insight to help with this crisis. And also the education and training needed to tackle this issue that is critical to our cities. Our vision is based on the knowledge that solutions to homelessness don't live in any single sector alone, and they require collaborations across sectors and across the university. I also want to take a moment to express my gratitude to the Bloomberg Center for Cities for making today possible. The initiative on health and homelessness has demonstrated again and again that addressing homelessness demands that we work across disciplines, across the university. And this event is a perfect example. I'm pleased also to tell you about another collaborative effort with the Bloomberg Center that complements the initiative on health and homelessness. This new initiative is the Harvard Urban Health Initiative. It is led by Gary Adankelich, who is there back at the road, who is in our faculty, and one of our Doctor of Public Health graduates, who's here on the first row, Kate Robb, who are bringing together researchers to deliver insights, innovative insights about key factors of health across our cities, including housing and healthy buildings, transportation, green space, sanitation, and more. It is clear that when our schools across Harvard come together, we make a difference. To all of our guests, thank you for being here. Thank you for the interest in this event and being part of the solution to homelessness. To our mayoral guests, you are on the front line, making decisions every day that directly shape not only our health, but our lives. We want to be a resource to you, and in equal measure, we want to learn from you. To our students, staff, and faculty, I hope you leave today informed and especially inspired. The people on this stage are doing the hard work, sometimes unglamorous, but essential work of governments in service of some of the most vulnerable people among us. And now that all the whistles said calm down, it's good they calm down because the real good part starts now. It is my great pleasure to introduce someone who has dedicated his career to the same cause. Former U.S. Assistant Secretary for Health and the Harvey Fineberg Professor of the Practice of Public Health Leadership at the Harvard THN School of Public Health and Faculty Chair of our initiative on health and homelessness, Dr. Howard Cohn. Thank you.
Thank you so much, Dean Beccarelli, for that warm welcome. And public health is about persevering through unexpected, sometimes noisy challenges. So we're off to an excellent start. And Dean, thank you for opening up and showing your leadership here. And it's my great honor to welcome all of you to a very, very special event. We are here because we understand that homelessness represents a highly visible and highly unacceptable humanitarian crisis, but we can solve it if we had everybody in this room and all the leaders in all the sectors across society, and especially our political leaders, our mayors, stepping up and taking charge of this crisis that is growing by the day. So this is a really historic event. Let me tell you how historic it is. In the opening 10 minutes here, we made some history. We have 7 mayors in this room.
Go.
Living in that. We have 4 in the audience, actually. Mayor Cynthia Block from Saskatoon, Canada. Mayor Julie Hoy from Salem, Oregon. Mayor Kevin McCarty from Sacramento, California. And Mayor Michael Zorozinski from Medford, Oregon. I'll introduce the 3 panelists in just a second, but before I start, I really want to thank our colleagues of the initiative who have worked so hard to make this panel a reality. Emily Lazobi and Kurt Vanling in the back, please give them a round of applause. Our brave colleagues from the Harvard Urban Health Initiative, the Aria Danforth and Kate Robb. And I hope Stacy Richardson is in the room. Stacy, you're there? Hang around a bunch with Stacy. All right, this woman was not slept over the last 2 days. So, but to have 46 mayors here from 16 countries tackling the toughest challenges of our time is what Harvard should be supporting. And so that's why we're so thrilled to be here. And let me start by introducing our 3 mayors who are panelists. Mayor Monroe Nichols from Tulsa, Oklahoma. Mayor Karen Knudsen from Eugene, Oregon. And Mayor Patrick Farrell from Huntington, West Virginia. So this is quite a lineup, and each mayor here in the audience and at this center gathering cares deeply about tackling tough issues of our time. There's no issue that's more tough than health and homelessness. So just to start, I'd like to ask each of the mayors to explain briefly, how has homelessness affected your city, and why, of all the issues you could tackle, why did you prioritize homelessness as a major agenda item for your tenure as mayor? And then Nichols, do you want to start on that?
Right. Well, yeah, absolutely. Thank you so much, Dr. Floyd, for all your the pre-call and everything you're doing. I will say, like, this is such an important issue to every mayor across the country. And in our context, when I came into office, the year before I came to office, homelessness grew like 22% or something like that. The year before I came in, first year in, the growth had slowed, right? But as I think about all the issues we deal with as mayors, homelessness touches each of them in some way, shape, or form. We have a huge focus on young people. Well, family homelessness grew by 34%, which has a crippling effect on absentee rates, which has a crippling effect on outcomes for students, right? Obviously, we know the economic challenges associated with homelessness. That's not a hard argument to make, but everything, public safety, public health, all the things that we have to do as a city are impacted by this issue of homelessness. And it is the one issue that we have that we deal with every day where there's not a system that exists to deal with it. And so it makes it a uniquely kind of a city challenge to solve. I think what we all know is that in theory, federal government doesn't have to invest in it. Nobody's going to go to their congressman and say, fix homelessness, or the president. A governor can likely do the same because, you don't feel it, but you feel it in your communities, on your streets. And so that makes it, probably of all the issues we deal with, it makes it the most unique city challenge, and a challenge that's not easy, and a challenge that requires a lot of collaboration, a lot of innovation. And so I chose it as an issue because I don't think there's a greater individual issue, because it is the one individual issue that actually incorporates all other issues. And again, one that a system does exist. So we have to take on that challenge and see.
Mayor Parkinson from Eugene. How does homelessness affect our community and our city? We have the unfortunate distinction in Eugene of having one of the highest per capita rates of homelessness in the nation, and that does not happen in a vacuum. I'm a licensed architect in the state of Oregon. I've done a lot of housing advocacy work within our community, within our state. I've been very engaged in Oregon's landmark housing reforms over this last 6 and 8 years, and my work is in practice and in teaching sustainable urban design. When we talk about our community, we talk about housing as the foundation for health and opportunity. And the absence of housing is the absence of that foundation. And so our work in the city of Eugene is always to ensure that everyone in our community has the opportunity to build the life that they imagine, to have those roots growing deeper every day, week, month, and year, that they have the opportunity to invest in such a beautiful place to call home, which is what we feel about the Southern Lapa Valley. And the work that we do in homelessness is expansive because, as we discussed over lunch in these past few days, cities didn't used to be in the business of managing homelessness. We are not the public health authority. We are not Department of Health and Human Services in our area, but we are the place where the consequences of the absence of adequate resources and effective programs and those levels of government present in our community. So while we may not be directly impacted in our budgets, from the federal level or from the state level, we are directly impacted every day because it is our constituencies, our neighbors who are affected by the absence of opportunity and the real harms of that experience.
Mayor Farrell?
Yeah, good afternoon. I don't think you'll find a mayor in the country that won't say that public safety is job number one. And I am from a small town, Huntington, West Virginia, 50,000 people. It's in the heart of Appalachia. And sometimes leaders don't get to choose their problems. And as I came into office, what I've realized is that public safety was being compromised. And that was being compromised because we were still feeling the effects of the opioid epidemic. Our overdose rate rivals that of San Francisco, Baltimore County. Our homeless population probably 2 or 3 times the national average, about 1% of our total population. And I realized that if we didn't attack this issue, we didn't tackle it in a way that we could bring not just actual safety for the people that were living on the streets and the people that are living in the city, but the perceived safety factor, that we weren't going to be able to attract businesses. We weren't going to be able to fix the infrastructure. We weren't going to be able to give hope to the young people in our city that wanted to stay and were only looking for reasons to leave. And so it became the first thing I needed to tackle to be able to build on everything else.
Okay, so let's start in. A lot of the crisis revolves around the fact that we have so many systems that need to be fixed. And so this first question is to you, Mayor Kinson. If we're trying to build a better health system, emergency responders, health professionals, public health departments, hospitals, community providers, and have a more effective response to the crisis on the street, what does that look like for you and Eugene and Harvey?
That's an amazing question. First thing I suppose it makes you think about is that we should never miss the opportunities presented with a crisis. And in our community, the crisis of homelessness that people experience is also within the context of a health system that has extraordinary pressure stuck on it. We have done incredibly innovative things within the state of Oregon over many decades to work to ensure that people in our state have access to health care, have access to health insurance, that children are cared for in our systems. And the experience still in our communities are that we have too many people who are not accessing adequate health care and also do not have the housing stability that they need. In the context that I've already shared with you about our community, I will say that we're a city of 180,000 in a metro area of about 350. And then I say about that size. And so we are not a large city, but we have generated out of necessity a lot of innovative approaches in this work. And the way that that looks in our mid-sized city on the ground is that typically, and the cities can be a place gradation, right? It is one of the upsides to not being the public health authority, to not being the Department of Health and Human Services, is that we can really think differently about the kind of problem that we're trying to solve, and then bring that creativity to our very strong partnerships with our county partners, Lane County in particular, and our healthcare service providers. one of the examples that I wanted to share with you all today is a project that is now combining the opportunity for neighbors, people in our community to transition out of the experience of unsheltered homelessness into community, but also down access to healthcare. That nonprofit initiative is now called Everyone Village. We've done a lot of work in the city of Eugene, innovative work in transitional housing, the tiny home village models for my villages. That was born out of Eugene, and incredibly innovative community-based work that now sharing on all across the country. Everyone Village as a different nonprofit and is built off of that village model, the idea that people in community can self-govern, even when coming to that community from extraordinary vulnerability and exposure. And that organization stood up really out of an early investment from the city of Eugene. There was a 3.5 acre parcel as your inner west of our city that a community member who was engaged with a conversation that one of our local faith leaders was having with the unhoused in our community and said, look, if you guys need a place, we can provide you with these sticks, the square footage on the ground, but you'll have to do the rest of the work. They know have to build a partnerships. So the city invested about $500,000 in the site infrastructure to just stabilize that essentially safe sleep site, and then it has grown over time in investment. And what is really exciting about that circumstance now is that this is not just a safe sleep site, it is a village with more than 70 units that are small modular units. Many of these constructed through some of our community technical education programs, our CT programs within our school systems. And those 70 units now also have access to an on-site clinic. And that clinic is funded through partnerships with our city, with Peace Health, which is our local hospital, trauma 2 hospital within the J. Springfield area, and with volunteer support from Volunteers in Medicine. And what we've done with that model, and why I think it's important for you all to hear, is that we've taken the crisis of our ER needing to manage all healthcare needs for our most population, which is too much for a single hospital ER to manage, certainly. And we've looked at that circumstance and asked questions about how could we bring the care that is needed closer to where people are, reduce the burdens on all of the layers of the system, especially on the person who is experiencing all of the barriers in that system to receiving what they need. So it's a really, I think, inspiring model of a way of taking access to healthcare, because so many people, not just our health population, are leaning on the ER as their primary line of healthcare in our country, and pulling that out of the hospital, creating new space in our ER to meet the other needs, and it is still overburdened significantly. That's a real crisis in our community in terms of that capacity. But pulling that resource closer to where people are, and in the future, that could be a neighborhood scale resource to a lot of different people.
Okay, thank you for those examples. So let's move on and talking more about governance and leadership. And I want to ask Mayor Nichols and Mayor Farrell about this. So, Mayor Nichols, how are you leveraging your leadership with respect to aligning with the city, county, state officials to coordinate in response? That can get very tricky. So tell us your experience and also here.
It's a varied experience, and I'll just give a couple of examples of that. So as a city, as I said before, I'm holding two microphones. I was just got had a duck in the front row, making so as a city, as I said before, I talk in my head. It's so weird. Yeah, they'll have it. Take it away from them. All right, sorry. But as I mentioned before, when you're at the city level, there's just a different deal. Like they're gonna ask things of you that they won't even ask a county commissioner or county executive. Like it is mayor, what are you gonna do about it? And so what I have found is that as a mayor, the intensity level that I approach every conversation with about homelessness is just a little bit more than any other elected official that I might engage. Because if we're being honest, this is not anything against anybody who's in the Tulsa area and state of Oklahoma, although I have a story that might be a little critical of somebody in state of Oklahoma. It's not necessarily criticized, it's just the nature of the job. And so as we began down this road, there's this perception of from the state, what causes homelessness, what should we do about it? How that materialized itself in my first year in office is the governor sending down the highway patrol to try to break up encampments without having any place for anybody to go. I mean, like killed a dog, like that kind of stuff. And these folks lost their IDs, they lost their, their paperwork. And some of those folks were in the pipeline for housing who now had to almost start all over it because they didn't even have the stuff they need to get there. So that lack of coordination was incredibly disruptive. At the county level, and we went through a lot of conversations about a particular piece of property that we wanted to acquire for a low barrier shelter. Took us a while to get there. We finally were able to get there with the county because the county is a little bit closer. And then us as a city had to look deeply at, okay, what's the funding mix of the things that we have going on locally? And so we had an analysis done that you can actually find if you Google City of Tulsa local civic and homelessness. We found that as a local community, both us and county government spend about 6% of the resources needed to address the issue of homelessness. And so what I found then was, if you're going to build a strong multi-level coalition from a governmental standpoint, you got to first take a hard look in the mirror about what you're spending. And if you're not spending, how can I go to the governor? How can I go to other folks and say, you're going to help? So we launched Safe Move Tulsa, which was, it's really our effort to help in street sleeping. So we have outreach workers that are going out, connecting people to housing, but also the supportive services along with it. We stepped into a situation where you didn't have access to enough housing vouchers. You didn't have enough affordable units. You already know that's a fixed deal that we can't solve on day one. So we didn't, kind of a market study to say, hey, what does it just cost to put people in units at market rate? And we began down that road housing folks. The first year in office, and this is not, this is certainly I'm proud of the role that we've played, but it's a broader role of the community. House 1,000 people for the first time since COVID, right? When we're just putting people anywhere. So a 24% increase in the folks who are homeless to us now is the first year on us in office. We believe that we'll have a slight decline in the number of folks who are actually homeless this year because of the efforts that we have put forward collectively. And it started with appointing somebody, which is true in probably Boston, and true in LA, but actually having somebody who wakes up every day and homelessness is just their job. So Emily Hall in my office is a senior advisor for homelessness, which I think she may be the first person of her kind in the state of Oklahoma, because it takes just that much effort. Because the other part of that stool between the state, local, and county government is private philanthropy, and so making sure in the business community locally, and so making sure we're finding ways to work together to make these investments because we know that's a spot where we struggle with. So it really was built on us taking accountability locally on how we're spending from a human capital standpoint, leadership standpoint, but also how we're spending money. And so I present the budget, the city budget on next Wednesday. So pray for me if you don't mind. But as part of that city budget, we'll be presenting an investment of $23 million to go toward the homelessness work we're doing on a go-forward basis, understanding that if we are going to, really build a strong coalition of partners, the investment actually does matter. The practice matters, and we're working on the practice for sure, but the investment also matters. And so for the first time in the history of the city, not just spending on housing, that's important, but we need that to work kind of concurrent with what we're doing, not just kind of being involved, casually on the mental health conversation, but deeply invest in the work and help and lead the work. That is how you build, I think, a coalition. It's tough as a city because we don't have none of us raise your hand, mayors, if you're sitting on billions of dollars to do the police. I don't think anybody's gonna raise their hand. But so there's this resource constraint, which is the reason why the data matters, which is the reason why outcomes matter, which is the reason why accountability matters. And I think we have to talk a lot more about those things in the context of homelessness. Last thing I'll kind of say, Jeffrey Canada, who is, I think, a Harvard grad, started Harlem Children's Zone. Jeffrey Canada told this fascinating story one time. He got on this board of this cancer research institution in New York City. And he gets there, and his first question is, he said, we spent trillions of dollars on cancer. Why do we still have cancer? And because I get this question about homelessness all the time. We're spending a whole bunch of money. And one of the physicians told him, he said, well, Mr. Canada, the problem is you're thinking about cancer as one disease, and cancer is 400 different diseases, right? And so that's why the data matters. That's why it matters if we're improving outcomes and how we're doing it, because people also have to have some sense that this is an achievable, the goals that we have are achievable. And so I think you got to be with the investment. The investment is, I believe, how you start to lead, but how you sustain the work is through the accountability side and making sure that you can go back and tell people that the money does matter, the money does work. Because what we battle is people that gets an unsolved problem, so they don't want to invest in it, and so we have to overcome that. Oh,
Thank you, Mayor. I'm going to ask related leadership questions to Mayor Farrell. So as you're tackling public safety and public health issues related to homelessness in Huntington, how do you sustain momentum? How do you build trust? How do you get people to support your work as you move this in here?
So I think the biggest public health crisis the probably world has faced was COVID. And it didn't take much to align incentives around behavior when it came to COVID. Everybody understood what the threat was and that they need to do something together. And in my city, when I came into office, we had two very well-meaning nonprofits tackling homelessness. But we didn't have a system. We didn't have everyone with the same incentives thinking about this as a challenge. And so what we've done to try to sustain it is to align the incentives of all the partners. And so to do that, we had to show the county commission that if you want property values to go up, because that's their main funding source, that we had to solve this problem. We had to help the hospitals understand the cost to their ERs and to show them that, like, when we take somebody that's living on the streets to the ER, back to the streets, back to the jail, it's the most costly, least effective way to solve this problem. And so what we've really tried to do is to continue to keep people focused on the problem and show them that this long-term incentive function would really help solve the problem for them. And by keeping them focused on that, I think we found that we've gotten more partners at the table. So now instead of just two nonprofits working on it, we have, the CEO of our biggest hospital with us on a board that's addressing it. We've got the Fairly Qualified Healthcare Center of the CEOs with us. We've got the county commission with us. We've got the university with us because we've shown them that this is the only way forward in a sustainable way is to align those incentives so that the financials follow the behavior and we get the outcome that we want.
I love these leadership themes coming forward about bringing everybody together, all the sectors together, because without your leadership, everybody's going to be looking for somebody else to talk with. If he was the mayor that said, I want everybody at the table working together, supporting each other to reach these goals, that's the way we'll make progress. All three of you have mentioned very quickly something about data and metrics. So maybe just in a minute each, as you think about data and metrics as you're doing your work, which ones are your favorite points? Let's see. Let's start with Farrell first.
Yeah, we're framing this as an intersection between public safety and public health. And so we've exposed that data in a public safety dashboard where we show our community the effects of the actual costs that our police department, our EMS personnel are spending to respond to homelessness. Now that many people were very wary of that, because if we show that, like it makes them think, well, why are you doing this? But I also say that if we're going to spend it anyways, why not spend it on prevention? And if we don't track those costs, as Monroe said, that, like, if they don't see it, they won't know. So we make all the data public. We show the number of response calls that we have from our police department, from our EMS folks. We show what we believe to be the actual number of people experiencing homeless at any given time. PIT counts are notoriously difficult. The point in time counts are notoriously difficult as a metric. But we think that by sharing data, at least we'll come to a common understanding. Because if we all have our own opinions, right, the conversations get very disjointed. But when you base it in data, you can then make better decisions as a group differently than you would if you were all just going off opinions.
Right.
I will give a shout out to our county priorities and begin by saying that when I came into office, I was in an early meeting with our Poverty and Homelessness Board, which was one of our interjurisdictional coordination boards to keep us all pushing and pulling in the same directions around this work of poverty and homelessness specifically. And one of our county staff mentioned to me the superlative description of the data that we have in our county that we work with. It's in our HMIS database that is homelessness by name, that has extraordinary amount of information buried in a not great user interface, I will admit. Not easy for a lot of people to look at, especially not as our expectations of that interface continuously increase. But we have excellent data and our county staff sharing. So it's the only data that the Congress will accept directly out of our system as evidence of need. I mention it because recently there was an article, a larger city not that far from us was announcing, the incredibly difficult conversation they were having because they were now improving their data collection. And they were going to discover, lo and behold, that there are more people living without housing in their community than they realized as soon as they had better data. And that now is a sort of political landmine to be navigated. And I was reading that article and thinking, well, we've been, we've been taking the hard knocks for years over the high level of homelessness in our community per capita, but we've had really good data while we've done it. And that has supported the work that we've done and the interventions that we've had. I'll also share as another data point because I'm very proud of it in the state of Oregon. Our previous mayor and myself both advocated for work statewide to essentially establish a sustainable shelter funding system in our state. Because I'm of course going to talk a lot about housing. I am an architect. I'm focused on housing as the solution to homelessness of all different types. My predecessor, a dear relationship with, came into the mayor's office from her work in our safety net and in our social sector, and her work was focused on the experience of homelessness and shelter provision. And so, of course, during her tenure, there was significant investment by our city in our shelter system, and we needed that. One of the data points that we need to have a larger conversation in our community about is how much shelter is the right amount of shelter. And is that you able to have those conversations, which are absolutely enriching conversations and sometimes uncomfortable. I've learned that we don't actually need that much more shelter. We need maybe 100 more spaces, maybe 200. But what we really need to work on is the pipeline out of that experience and through that experience. That is one of the things that our current administration and the massive shifts in policy has really undermined. That pipeline out of the experience of homelessness once you have access to organic shelter. We've lost a lot of case managers in our community. But the reason I haven't mentioned that system is that through that process of advocacy at our state level, I learned that our urban delivery of this resource to the stability in our community is about the very most efficient in the state, if not the most efficient in the state. It's 10 times more efficient than some of our colleagues in other cities and communities. And I think that needs to be part of our conversation as we're talking about transitional support, where we are seeking long-term permanent stability for our communities. We all want for people to spend their life experience in a shelter circumstance. And because it's temporary, we also want to be able to develop the programs, policies, and the supports to make it as efficient as possible and to connect it to the continuum of housing and to long-term stability.
Yeah, I couldn't agree more. I mean, I always said, shelter should be like how we think about emergency rooms. And far too often they become what we think about apartments. And that's not, we have to be in a place where there's some churn in the system. And so even thinking about how many people does one bed serve is a good indication on how well the system is working, as long as there's, good reasons why they transition out. From a data standpoint, when I was running for mayor, I talked about us getting to functional zero homelessness by 2030. That was the goal. And so for us, what that means is we have about 3,000 people who become homeless in our community every single year. And so driving indicator number one is, do we have 3,001 units that we can get those people to? So like that's that, and we're not there yet, but that's the goal, right? So from a system standpoint, making sure that our available resource for housing is greater than the number of people who fall into it every year. The second thing really has been focused on the wait period. The standard is 45 days or less. The reality when I took office was 220 days that somebody's waiting for housing from first contact to the day they turn a key into a door. Like, do you imagine the kind of resilience you have to wait a year to get into a house? And you're doing everything right, by the way, so drive that down in the initiative that I've mentioned, Safe Move Tulsa. We're tracking about 37 days right now. Of course, we're gonna have to get it to scale, but there's some signs that the system can work better with some intentionality associated with it. And then the third kind of driving large scale indicator is, that 2-year check-in. Or is the number less than 5% of the people we served who are back in the streets again? So we know we are not feeding back into the chronic homelessness challenge, right? And so everything that we're doing in the intermediate is Safe Move Tulsa the goal through that very specific initiative targeting encampments and streets to house 300 people in a year, this first year, starting November. We're about 118 now. We are getting ready to kick off what we call a rapid exit strategy. So folks who have been in those shelters, who have been in the emergency room for a long time, making sure we can transition them out of the emergency room into housing with the supports they need, which will then allow us to get some of the folks who are down the campus to the additional shelter, so we can start to see the system work a little bit better. So through that rapid exit strategy, the goal is to house 1,000 people out of that, right? So you got 300, you got 1,000 on top of what we believe should be a base of housing 1,000 people every year. You're starting to get really close to where we would like to be with addressing that 3,000 number. And so those are some of the things that kind of drive us. At me as mayor, it's the initiatives. Where are we against that 300? Where are we against that 1,000 on the rapid exits? Where are we tracking on the time it takes from an outreach worker's first contact to turn the key at a door? Where are we on our housing stock? You can look at, we have a housing tracker up right now that drives me crazy all the time to look at it every day. Look at our affordable housing work. We launched a housing impact fund to get more affordable housing. So, but the question is, are all these things just happening, or are they working together to build a strong system locally? And so that knitting together of all these strategies is really critical, with those three leading indicators around stock, around effectiveness, and then around, wait times being the three things I think about every mayor.
I can't believe this is going to be the last question I asked you, so I'm going to give you 1 minute each to respond quickly.
Good luck.
If you had to recommend one policy or investment that
Oh,
should be scaled up and prioritized for all mayors in the country, what would that be, and what gives you hope for the future? So
you'll start with there.
Fireball. One and one.
In the line. I think the one thing that I had seen evidence-based practices or having a by name list. It's, as you mentioned about cancer, knowing who these people are, that they're people, not numbers, and that if you know who they are and you know who they are in the community, it's certainly easier in a place like Huntington than it is in maybe a bigger city. But that by name list, I think, can really drive better outcomes. You treat individuals like people, like humans that need someplace to go. I think that you'll find that you can get them into recovery, get them into temporary housing, permanent housing, or some other outcome that's beneficial to them. And so what gives me hope for the future is that we have so many people working on this. Right? I don't think I can remember a time where we had our leading universities and researchers leaning into this, that we had cities working with counties. This never happened in the past, as Mayor McCarty said earlier, right? That we initially didn't think that this was the work that we were going to do, but now so many mayors around the world are focused on it. And that gives me hope, because I believe that anything that we decide to do, we can do. And we are doing it. And so I'm very hopeful.
Thank you, ma'am.
Earlier, I was sharing with another male colleague what an impossible question is. One action to address the experience of homelessness and solve this problem. But I'm going to lean into the area that all the data has told me that we need to lean into, which is that we are not funding housing. We're not funding it in the ways that we need to. And the policy action that we need is to fund the housing that our attendees need. And when I talk with my students about the possibilities, and now is an interesting time to be talking about even about possibilities. A lot of people feel like maybe the window of opportunities are closing. I do not feel that way at all. I feel like where we are now is an opportunity to be able to think really expansively about the future and what's possible. And when I share with my students early 20th century housing policy history, we talk about it's 1932, 1933, 1934. Some things changed. Not everything that happened with those policies was good, but it was an expansive intervention to drive a significant change across the experience of people in our country. When I think about what's possible in communities, working in partnership, having performance metrics, having accountability, and then responsibility at the local level, we now have those networks and very data. The Housing Act of 2028 is not beyond me to imagine. Like, we could do this work, and we desperately need more mandate for permanent support housing. But we also need more funding for affordable housing and workforce housing. And cities are the places that best know why housing is needed for the vast majority of Americans. So we really need to reinvest in a relationship between the funding that we need, the resources, and the local accountability to deliver those resources in the most effective way possible. Because cities are very interested in solving the problem, but we've learned a lot over the last 100 years. The thing that gives me hope, I probably already previewed it, I think we're capable of doing this work. There's no question in my mind that we have the capacity as humans to imagine agreement, to frame problems effectively, to agree on the problem that we're trying to solve, and then to have conversations about the very rational solutions that we all agree on because we agree on the problem. And still in homelessness, we have work to do on that front. We still have conversations every day, as there's, I'm sure, about why it is that a person is experiencing homelessness. And an individual is complex. We all are as humans. The data at the city scale, regional information would tell us the reason that you have a lot of people homeless in your community, Eugene, Oregon, is because you had a decade of vacancy under 5%, more than incredibly brittle, inaccessible housing market. And during that time, you had almost no ability for average wages to access the average unit of housing in terms of costs. And the data tells us that those evictions have the influence of high degree of homelessness. That's not going to be the precipitating event for a longer, most challenging circumstances in community. The challenges we face in Oregon with a lack of funding, this is nationwide as well, to serious mental illness, to addiction, and disorders associated with it. We need that work as well, but those services will not be successful if people do not have a stable place where they receive them.
Yeah. Sorry, story. So when I was campaigning for mayor, I went out with outreach workers and met several folks who were living on the street. You got, you tell, like, oh, tell me your story, So, but you sit there, you talk to folks, and I remember meeting this woman. She actually was able to stay at a old hotel that the day center, was able to pay rent for her to stay there for a little while. But she had been, I think at that point, she'd been on the streets for a little over a year and a half, I think it was. And I asked her, what'd you do? She was a teacher. She got into a relationship, not the best relationship in the world. Um, Led her to spiral a bit. She lost her teaching contract, and then she was on the street. And she tells me that she's like, I'm gonna be honest with you, I am a drug user. And she asked me, why did I think that she was a drug user? I was like, I don't know. But she said, I started to stay awake so I didn't get raped on the streets. That's what she told, which is like, yeah, I mean, I just never, it really, really stumped with me. Here's this person who was a teacher, bad circumstance leads you to the streets. And now, because we were not able to address what could have been a relatively easy issue to address early on, you're out here, you're drug addicted, that kind of stuff. She ends on my first year in office. She is now housed, but the thing in that story that really got me is that there's not enough resources for people who need a quick way to address the issue that they have. We make people wait until they are absolutely in a horrible position to help them. And what gives me hope is that the data tells us in Tulsa, Oklahoma, and I bet this data is probably consistent nationally, like 80% of the issues that we see and 80% plus issues that we see when it comes to homelessness can be solved with a rapid resolution. We just don't have the resources to do it. So if you were to ask me where I think we should put resources, it is flexible dollars to help people as soon as they have an issue. We can within imagine how much easier it is to deal with some of the chronic issues we have, but imagine this teacher, if we could help her immediately. That's one less person on the streets. That's one less person who's drug addicted. That might be someone who's in the front of the classroom right now. But we weren't able to do that. And so, all the resources that we're cobbling together, most of them are highly restrictive dollars. And so the unrestricted resource was to address the issues that people have as quickly as we can would be the thing that I would ask for. And we have a good test case for it. Mayor mentioned COVID. Remember how many people we housed during the pandemic to get them off the streets? It was just a question of money. We had the ability to get them there. So I do think the flexible resources around rapid resolution would be the investment would be a game changer on the issue of homelessness.
Mayor, we are so impressed by your knowledge and your commitment and your compassion. What a fabulous panel. Big round of applause for our panel. To close us off for the last couple minutes, I want to welcome my dear colleague, Michael Danpowitz. He's going to put this all in perspective for me.
We're gonna quickly wrap this up. I just want to thank everyone for being here. I will get you out of here by 2 o'clock. Before I start, for the students in the room, um, you're all here for very specific educational missions, but I just really want to underscore the other big pieces of your education that ties to the reason you came here is to improve public health and change the world. And part of that is hearing directly from leaders who have to struggle with the complications. There are no more simple problems in public health. The complications of really identifying a problem, measuring it, trying to address it, and there's no one size fits all. Listening to leaders like this is a really important part of your education. And the other piece that Nichols mentioned in terms of hearing about the lived experience of folks you are trying to help, that is powerful. And in a world where we so much rely on quantitative data and p-values, now I don't need to prove that story to you. That is real. Um, and it's powerful in our psyche. 4 days from now, if I ask you to quickly describe this event, I guarantee you will talk about electronic bird chirping and that story. That those will be the first two things that you remember, and then all of the great leadership examples. So as we said before, I'm going to cut some of my I just wanted to share that. First, I want to really thank Howard and all our guests, panelists, and colleagues. As it said before, I'm Barry Demkowitz. I'm a faculty member here at the School of Public Health. I'm also leading with Kate Robb, the Harvard Urban Health Initiative, which is a great new program within the Bloomberg Center for Cities. Our initiative is really proud to co-sponsor this event under Howard's leadership, which aligns with our mission to support city leaders with evidence generation, translation, expert convenings, dialogue to support and improve urban health policy. We are still quite new, but stay tuned and try to get involved. I'm so happy that there's so many people in this room. And if all of you come to see us, there's no stopping what we can do. We heard today from mayors and our panelists. What we heard was not abstract. These are stories from the front lines, cities making hard decisions. What strikes me is how much this conversation has evolved. We're past the point of debating whether homelessness is a public health crisis. It is. It shatters lives. It kills. So those are facts. The question now is what cities with the right partnerships, the right data, the right political will can actually do about it. And let's be clear, homelessness is a failure, as you've heard today, of systems, markets, society. It is not a failure of the people who suffer when unhoused, period. Re-victimizing those who suffer should not be tolerated. We need to support our mayors who bravely choose, like the mayors before you, to serve the unhoused citizens of their city. Great leaders recognize that leadership is a service profession. That's what made this panel so valuable. We didn't hear about the problems. We heard about what's working. Obviously, we can't, this is such a big issue. We can't unpack everything in the space of an hour, but we've given you things to think about, things to follow up on. We've inspired you to email Howard and his team and ask how they can serve his initiative. And I'll just close with just a list of thank yous. To Howard, thanks for your leadership, your vision, your tireless commitment to the people this work is meant to serve. To Dean Baccarelli and the Chan School, thank you for being home to work that matters. And our Bloomberg colleagues who really have been so wonderful to work with. And because they've heard directly from mayors on how important this is in their work, that they are really partnering with us in a real way. And another PS about Howard, not to embarrass him, but I've said to many people, Howard's at a point in his career where he could just be sitting in his office counting his awards and printing out his 100-page CV, but he's not, and that
that I hope every student in this room appreciates that you're in a business of helping people and you're in a business of impact. And what a great way to sort of take all the amazing experience in leadership that Howard has and as a clinician in this space. To our mayors and speakers, you came here not because it was easy or because you had all the answers, but because you believe in learning from each other. That kind of intellectual humility is rare and powerful. We're grateful. And everyone in this room, researchers, practitioners, advocates, students, you're a part of this work too. Please take what you heard today back with you. Ask how it connects to what you're doing. Ask who you might call. Ask what your city organization, your research can contribute. And I'll close where I started with our students. We stand here within a school of public health. That is not just a name, it's actually a directive. Let's all try to double down on the meaning of the word public. The word degree will not dictate your title for the rest of your career. You can help the mayors in front of you solve the important problems they just described, or you too can be a mayor yourself. So just finally, solving problems in our neighborhoods and cities is a great way to start. But finally, just thank you all for being here. Thank you for caring about this issue. A few of us will hang around. We're all relatively easy to find. Or I think the mayors might be the only people with inboxes more busy than Howard's. So thank you for being here, and thank you for caring about this important issue. Thanks.